Story County, helping build Nevada's future.
Welcome to an all-new Nevada Newsmakers. Filling in for Sam Shad, I'm Mike Draper. We spend a lot of time on this program talking about Nevada's courts, its jails, its shortage of mental health programs. Today we're going to be talking about the point where all three of those collide. Our guest is Dr. Parrott, a forensic psychologist and the Vice President of Forensic Mental Health Programs for Naphcare, which handles a lot of the correctional and healthcare programs for jails around our state. So stay tuned.
If you can't feel safe in your home, in your neighborhood, nothing else matters. Walking a beat, as sheriff and as governor, Joe Lombardo has dedicated his life to keeping us safe. He strengthened domestic violence laws, made schools safer, and increased penalties on drug dealers. And today, violent crime is down. Property crime, down. Domestic crimes and crimes against the elderly, all down. Joe Lombardo, he's making a difference.
This summer, all roads lead to Hobie's Casino for trucks or bucks. Win up to $1,000 in cash every week. Then buckle up and win a brand new Tacoma or $35,000 in cash. Shift the winning into high gear at Hobie's Casino.
Meet Nevada Health Link, Nevada's official health insurance marketplace. Your link to savings, selection, free assistance, and name brand health insurance, where 90% of enrollees lower the cost of their monthly premium. Everyone deserves access to quality health coverage, no matter your income or family size. Visit NevadaHealthLink.com. A few minutes could save you hundreds of dollars per month.
Nevada Health Link. Our plans are made for your plans.
At Nevada Urban Indians in Reno, your health is our priority. Our medical clinic welcomes everyone. We accept all insurances, ensuring quality care is within reach. Nevada Urban Indians, your partners in health.
This is Nevada Newsmakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada Newsmakers broadcast headquarters, here is Sam Shad.
Welcome to an all-new Nevada Newsmakers. Filling in for Sam Shad, I'm Mike Draper. Today our guest is Dr. Parrott, a clinical forensic psychologist and Vice President of Forensic Medical Health Programs for Naphcare, which provides correctional health care for jails and prisons all around the country, as well as in Nevada. Caroline's a longtime friend and client. Caroline, thanks for joining us today.
Thanks for having me. Good morning.
So Caroline, before we get into this very important issue, let's begin with the larger problem. And how did our county jails, our state prisons, become one of our primary mental health treatment systems?
Yeah, well, it's not it sounds like a simple question, but it is not a simple answer. It's decades and decades that where we've evolved to this situation that we're all in across the nation. Most of the time, we're really thinking back to when we think about how we got here, we're really starting to look at what was meant as well-meaning efforts to improve the mental health system with deinstitutionalization of the civil hospitals back in the 60s, early 70s. Unfortunately, that movement led to less resources for persons living with serious mental illness or disabilities. So where people were supposed to be walking out of hospitals and being transitioned into community resources, unfortunately, those community resources weren't there in the amounts and the types that we needed. And over time, what you see is this increased population of persons living with serious mental illness without adequate access to treatment, without adequate access to housing and transportation and supports. And so in general, you see a rise of untreated serious mental illness and individuals living with disabilities without the supports they need. And so what you end up with along those same lines is an increase in substance use to cope with mental illness, or to get by, less gainful employment by this population, increase of arrest, unfortunately. And so what we in the field term and conceptualize it as is really what turns out to be like a criminalization of living with mental illness. So increased proportion of individuals who are suffering with a serious mental illness and or substance use disorder in our jails instead of in our hospitals, instead of in our community programs, instead of living at home with services on an outpatient basis. And so this proportion of individuals who are meant to be in treatment, and if they were in treatment, it would prevent them from ending up in jail, is really high. Research shows that in the last few decades, estimates were at like 25%. Then 37%, now above 40% that individuals, adults living with a major mental illness are in our jails. Meaning, put another way, of our jail population, it's around 40%, estimates vary, of individuals who are suffering with these serious mental illnesses and or in substance use is even higher. The Naphcare Foundation, actually, which is a nonprofit arm of Naphcare, who I've worked for, they actually did a research study across close to 40 jails, I believe, between like 2013 and 2023. And they saw that psychotropic medications, so medications that you would use to treat serious mental illness, it was like close to a 250% increase in the prescription of those medications in those jails over that 10-year period. And so it's really, we're at the point where our jails, our legislatures, our communities, our taxpayers, everybody's, I think, noticed that this is an issue, that this criminalization of having a mental illness or a disability is leading to basically our jails becoming our new mental health hospitals, and that is not the intention or the purpose of those facilities, clearly.
So obviously, Naphcare's had to address that, and specifically providing healthcare for jails and correctional systems. It's been well documented in Nevada that it's difficult to get. We have a provider shortage in general, but it's difficult to get, or some have asserted it's difficult to get quality healthcare in our jails and prisons. How does Naphcare go about addressing that?
Sure. So Naphcare, for a long time, as one of the leading correctional healthcare providers in jails across the country, has done an excellent job with medical treatment, healthcare treatment, baseline mental health treatment. But as we saw these mental health disorders increasing in prevalence and creating safety risks, security risks, health risks for our patients in jails and for our partners, we were responsive. So we were able to get on the preventative, proactive piece of it. And so what we're able to do is do really early screenings, really intensive mental health care services. We triage our cases. We track our cases using our innovative electronic health record, tech care. And we're able to keep a really close eye on this population. And for us, that's what we want to do. We want to see these individuals being seen by our mental health providers and those in jail. And one way to do that is when we recognize there's a particular population that needs particular services that are more intensive than what baseline jail mental health or healthcare services are, we're able to develop a specialized program working with our partners, our sheriff's office partners and county partners. We're able to develop a specialized program to target services for them. And that's what I oversee.
So when we come back, I want to talk about some of those programs. Our guest today is Dr. Caroline Parrott. We'll be back in just a minute.
A power line is more than a power line. It's maintaining the bottom line for small businesses. It's keeping the assembly line moving for our workforce. For our brightest minds, it's meeting a deadline. It's on the front line with our heroes. And on the sidelines of the biggest games. It's a direct line to our loved ones. And it's a lifeline for the most vulnerable. There's a lot on the line.
The trucking industry is the most resilient link in the supply chain, moving 95% of our freight in the Silver State. And while essential, the road isn't always smooth. Supply chain disruptions, rising fuel costs, and unrealistic rules and laws that hamper our ability to serve our customers and country. Our prosperity and every sector of the economy, manufacturing, mining, medicine, and food from farm to table, is tied to trucks. There's nothing without trucking.
As you know, Reno is booming. Toll's development company is helping it grow with insightful design and development, building community with every project, adding beauty, adding excitement, emphasizing our shared humanity. Reno is becoming bigger. Toll's development is helping it become better, more livable, more enjoyable. To learn more, go to tollsdevelopment.com. tollsdevelopment.com.
2025 is bringing big changes for Nevada businesses. If you have more than 5 employees and have been operating for 3 years or more, you must now comply with new state retirement plan mandates. The Vegas Chamber 401k plan makes it easy, offering a proven, customizable, and cost-effective plan for employers and employees to save with tax advantages. Visit vegaschamber.com to explore options and see how the Vegas Chamber can help you start saving for your future.
This is Nevada Newsmakers.
And we're back on an all-new Nevada Newsmakers. Filling in for Sam Shad, I'm Mike Draper. Our guest today is Dr. Caroline Parrott. She's the Vice President of Forensic and Mental Health Programs for Naphcare. Caroline, before we went to break, we were talking about our jails as our kind of last bastion of mental health. Naphcare has implemented some programs in the state that have received some acclaim, like the Thrive program in Washoe County. Can you tell us a little bit about that program?
Yeah, certainly. So Naphcare's been a longtime partner with different correctional facilities there in Nevada. And we partner in Clark County, we partner in Washoe County. Washoe County's been really exciting to work with because we've been able to partner with them to develop some innovative programs, some the first in the state. So initially with our MAT program, or medication assisted treatment program, and opioid treatment program, that was the first one to be certified actually by SAMHSA in Nevada. And we're actually expanding those MAT services. And so Washoe County and Naphcare have a history of working together to develop these innovative, specialized programs. And so it was great that were able to partner with them to develop the first forensic jail-based competency restoration program there in Nevada, which is in Reno. At the Washoe County Sheriff's Office Detention Facility.
Now, this is a program that the Nevada legislature discussed last legislative session, amongst other things, but decided to fund statewide to do full competency restoration. Can you explain to our viewers what that means? What is full competency restoration?
Yes. And so thanks to the efforts of many individuals across Nevada and the legislature, like you said, we were able to have funding starting in 2024 for jail-based treatment programs that were specialized for individuals who had been found incompetent to stand trial. So because of their mental illness or their disability, they're unable to understand enough of what's going on with their case and or to participate in their case in a way that's constitutionally expected and that they have a right to do. So when that happens, the court orders them to restoration or competency treatment. so they can be found competent to stand trial and the case can move forward. Previously in Nevada, we weren't able to provide jail-based restoration, or what you might call full restoration. What we were able to do in Clark County, and Nevada was able to do, is in Clark County and in Washoe County, develop specialized treatment programs that essentially targeted this population who were waiting to get to a state hospital, a state forensic hospital, for this restoration. So the individual is found incompetent, they're still in jail. Unfortunately, they're stuck in jail for weeks to months to much longer to try to get a bed or a place at the forensic hospital to be restored. And so what we were able to do was to develop Thrive there in Washoe County to provide really intensive specialized treatment on a therapeutic milieu for patients waiting to get to the hospital. What that did was jumpstart their functioning day to day, jumpstart their treatment, started them on medication or behavioral treatments, got them complying and ready to go. And once they got to the hospital, their restoration time, the time they were spent at the hospital getting restored, was much shorter, which means not only were we able to serve more people in Washoe County, we were able to serve more people throughout the state because those are shared beds. So under DPPH's scope of work, DPPH contracted with Washoe County, and Naphcare was able to provide that service. And with the change in the law to allow us to provide the entire restoration model starting January 1 of this year, we were able to go ahead and bring the full restoration model to the individual while they're in jail. So instead of waiting to get to a hospital and using resources to transfer them and get them in treatment, then transfer them back, where oftentimes they would then decompensate and become incompetent again, we're actually able to bring the entire full model to the Washoe County Sheriff's Office Detention Facility and provide restoration.
And I've read stories. I mean, obviously, in the long term, that's a significant savings for the taxpayer. But I've read stories where some of these defendants were potentially, while they were waiting to be deemed competent to stand trial, were potentially waiting in the jails for even longer than what their potential sentence was.
Oh, yes. And it's not just like a random story. That's part of this national crisis. Late around 2019, one of the leaders in our field essentially termed it a competency crisis. Remember, we have all these individuals in jail who are now sick. That means we have more individuals who are being found incompetent. So we need more evaluators to assess them. Then we need more beds in the hospitals to treat them. And it was a crisis nationwide. And so it was just getting longer and longer wait times. And as people get sicker in jail, it actually takes longer to restore them, because the sicker you get, the longer it takes for the medication and the treatment to work. And so it was just like a self-fulfilling problem, essentially, that we were feeding. Yes, there's many clinical benefits, but there's also the system benefits, where it's a much shorter length of restoration when you're able to triage the appropriate people to jail-based restoration. And research shows that it's a 50 to 80% less costly effort to treat someone for restoration in jail versus hospital. And so that's significant. So what we have to make sure we do is that we're just putting the right people in the jail-based treatment who can benefit from that in an efficient way that makes good use of those funds. And then people who need to go to the hospital, making sure that we're still doing that. So it's one part of a bigger solution.
Let's continue this discussion when we come back. We'll be back on an all-new Nevada Newsmakers.
Welcome to Story County, where history meets innovation and a pioneering spirit continues to shape our future. At the heart of the Tahoe Reno Industrial Center, we power the future with global leaders in technology and manufacturing, driving progress that reaches far beyond our county lines. From advanced manufacturing to tech innovation, our industries are creating thousands of quality careers, fueling a vibrant economy that benefits every Nevadan. Our community is our foundation, Be part of a legacy built on bold ideas and boundless possibilities. Story County, helping build Nevada's future.
Like a traditional handmade basket, retail is woven into the fabric of life in Nevada. From big box to mom and pop, retail supports our communities in countless ways. Jobs for the disabled, team uniforms for kids, help for the elderly, and so much more. Retail employs over 1 in 10 workers. Retail supports Nevada, and we support retail.
RANNV.org.
The Nevada Builders Alliance has been protecting the interests of the construction industry for over 50 years. Our programs save members thousands of dollars every year and allow them to provide much-needed benefits to their employees. Our industry also allows Nevada to grow. If you're thinking about a career in the construction industry, reach out. And if you haven't thought of a career in construction, what are you waiting for? We are the Nevada Builders Alliance.
We're the Peters family, 2 combat veterans, our daughter Elle, and our Liberty Dogs puppy in training, Cooper.
Cooper will grow up to be a life-changing companion to a veteran with visible or invisible challenges.
We're helping Cooper build focus and confidence so he's ready to support his veteran.
And we know he will help bring happiness and independence to his veteran's life.
So join us, become a puppy raiser, and change lives, one puppy at a time.
This is Nevada Newsmakers.
And we're back on an all-new Nevada Newsmakers. Filling in for Sam Shad, I'm Mike Draper. Our guest today is Dr. Caroline Parrott, a clinical forensic psychologist and the Vice President of Forensic Medical Health Programs for Naphcare. Caroline, we've been talking about competency restoration in our jails. Can you make the distinction? What's the difference between mental health treatment and competency restoration when we're talking about jails and prisons?
Sure. So baseline mental health treatment in a correctional setting, we want to identify mental health issues and we want to address them to keep people safe while they're detained. And so we want to help make sure that we're really proactively addressing those services with psychiatry services and coping skills to deal with their environment. It's really tied a lot into their medical condition, making sure that they're functioning, showering, eating, getting the medications they were on in the community, identifying new issues, and really keeping them as stable as possible. Jail-based competency treatment programs and restoration in general is focused on targeting specifically the clinical barriers that the court has found as interfering with their ability to participate and understand in their legal case. So we might not need someone to be as well functioning as they would if they were out in the community living on their own, for example. We need to target the symptoms that are interfering with their ability to move forward. So that might be things like a large portion of our population has a psychotic spectrum illness. So they might be hearing voices that others don't hear or having irrational beliefs that are about the judge or their case or their attorney that are making it difficult to work with them. And so we target those specifically with really comprehensive services. So it's a multidisciplinary treatment team that provides medication, therapy, coping skills, socialization, education about their medication, nursing, as well as individualized services to help target those specific needs. A lot of our individuals have cognitive disabilities, or issues related to anxiety or emotional problems that are interfering, and we're able to target those specifically on an individual basis. So there's no one size fits all when it comes to restoring somebody, just like there's no one size fits all when it comes to what model works best in which jurisdiction.
So we've got about 90 seconds left. Let me ask you this question. The Thrive program in Washoe County, which is one of the first certainly in the state, but I know one of the first in the country or very unique in the country. What makes that program different?
Yeah, so Thrive is really individualized for each individual. You're not going to get the same treatment plan for patient A as you do for patient B. So Naphcare really focuses on the individual and what they need to help move them through the system as quickly as possible, as well as possible. We're very holistic in our approach, making sure that the person is going to be able to maintain that those benefits from the program as well, so they don't decompensate. So Naphcare, this Thrive program, is really comprehensive there in Washoe County and is pretty much, like a standalone level unit there in the facility, making sure that we see the patient from start to end in this process.
So last question, and I know it's a complicated question, but 30 seconds. What's the biggest challenge facing our jails and prisons as it relates to mental health right now? Is it funding? Is it more beds? What's the biggest challenge?
I'm going to say funding. Obviously, more beds are good, but we like to say in our field, you're not going to build your way out of this. States who just build more beds and more beds and more beds are missing the boat. You need those beds, but you need an entire system. You need the community resources, the jail-based resources, the hospital resources. If you can get the continuum of restoration care and make sure adequate funding that's sustainable for all of those intercepts, you're going to find in the long run, less people are going to end up in that system. And overall, it'll be a cost saving and people will get better and the justice system will move forward, which is the whole point.
Caroline, we really appreciate your time today. Obviously, we could talk for hours about this, so we're going to have you back on. But thank you so much for your time today.
Yeah, anytime I get a chance to talk about this need and this population and how we can bring solutions to it, I'm all for it. So we'll keep the discussions going.
Perfect. Thank you. And we'll be back on an all-new Nevada Newsmakers.
Light up your July at the Carson Valley Inn. Win up to $25,000 in the All-American Progressive giveaways. $1,500 winner guaranteed each drawing night. And $30,000 in grand prize giveaways. Only at the Carson Valley Inn.
Each day, the Children's Advocacy Alliance partners with leaders, legislators, and families across Nevada to improve children's health, education, economic well-being, and safety. We recognize Nevada will be no better than the state of its children. Be a part of this change. Be a supporter of the Children's Advocacy Alliance. For more information, go to caanv.org.
Welcome to the Ahern Boutique Hotel, where luxury and warmth come together in the heart of Las Vegas.
We take pride in offering a one-of-a-kind experience for both locals and tourists.
Join us for handcrafted cocktails and an unforgettable experience.
Joel's Chop House, the perfect place to savor views of the Las Vegas Strip.
Satisfy your cravings at the Ahern Chocolate Shop.
No smoking, no resort fees, and the parking is always free. The Ahern Luxury Boutique Hotel is your home away from home.
Thanks for watching Nevada Newsmakers. You can catch up on the last 24 years of Nevada Newsmakers by going to our website. Over 2,600 shows available there. Plus, you can also download audio and video podcasts and watch us on YouTube. We'll see you on the next broadcast. Thanks for watching Nevada News.